Before I present our drug, if you look at our drug in the similar studies, our drug did not increase any body weight in a weight gain. It's very clean profile. I'll walk you through. You can, to a great extent, you can guess. So this is another thing, the treatment compliance. So when doctors say treatment is required forever, many patients, if they feel better, they discontinue treatment. So they think that, okay, I'm good, why do I need treatment? The problem is, after a couple of weeks, maybe month, they may end up in hospital for psychotic conditions. This is called compliance. So if you think it over, your brain is like a computer disk. So let's see why it is important to keep taking medication in the psychiatry. Every time the patients we call relapse to medical symptom, terminology, when they get the attack, hallucination or things every time, part of that brain tissue will be damaged. It's a permanent damage in many patients. It doesn't work. It's like a computer disk, less a dent, and then it doesn't work. Similarly, after 10 to 15 years, if they are not taking medication, multiple attacks, and then no treatment will work in them. That's lifelong they have to be suffering from schizophrenia. That's the problem. It's very important to take medication. So here is some of the data. This is based in the US. India, we don't have data. So schizophrenia patients often suffer from multiple diseases. They take multiple medication. In the medical term, we call polypharmacy. So lesser the drug, safer. So more and more medication, if a patient takes this, leads to a lot of side effects. So I just put together some data here. This is an outpatient prescription pattern. Around 17% of patients in the US, they take 2 prescriptions. And around 9% they take anyway 3 prescriptions, 5%, 6 prescriptions per visit. More than one drug, if a patient takes, add up a lot of side effects. So what I need to highlight here is many schizophrenia patients, they suffer from multiple diseases, and then they drug-induced side effects, multiple drugs. If they take medication for schizophrenia, their diabetes medication may not work very well. If the diabetes medication works well, schizophrenia drug may not work. It's extremely important if patient experience side effect, consult doctor, this drug is not working, and then I need to change the medication. It's extremely important. So if you go back to the previous slide here, so often multiple medications we should try to avoid as much as possible. But in reality, these days you get a lot of medication. It's like you need that first in the morning, 4 to 5 drugs medications. More and more than one drug taking it increases the odds of side effects. If you look at the current database, around 700 drugs currently in the market are known to cause liver damage. So some of the drugs like BHAT and IPF currently in the market, after taking a couple of years, they permanently have liver damage. So these are some of the side effects associated with the current drug. So we need new treatment. Go to the next slide. So in summary, schizophrenia is not a single disease. The major symptoms highlighted here: positive symptoms, negative symptoms, cognitive impairment. Neuroinflammation is kind of a recent one. Our drug has a potent anti-inflammatory activity. Whenever a drug has anti-inflammatory activity, the drug what you take, ibuprofen or something, that's a different type. This inflammation is different. This is the neuroinflammation, not just the body inflammation. So neuroinflammation can not only help the recovery patient faster, but also side effects can be significantly mitigated. So if you go to the next slide. So in overall, the brilaroxazine is our drug compared to the 6 drugs currently in the market. They are all blockbuster drugs. If you look at Zyprexa and Risperidone, I believe in India they are widely used. Zyprexa is a drug discovered in 1995. In 4 to 6 weeks of treatment, it causes around 8-pound weight gain in patients, and then maybe so with the Risperidone, it causes prolactin increase. And in 4 to 6 months of treatment, patients will suffer from diabetes, dyslipidemia, the rest of their life. The newer drugs highlighted here, cerebral, Abilify, Layla, and Lexilti, they got approved in the last 20 years. Slightly incremental improvement in safety, they became blockbuster drugs. If you look at our drug, Rivaroxaban, in terms of efficacy and safety, it's much better than currently available or widely used medication. To walk you through some of the data, those who are interested, I would not go into detail again, and please feel free to ask me a question. So, I did not put too much information on other indications. Some of the antipsychotics currently in the market, or these are the treatment for schizophrenia, bipolar, or major depressive disorder currently in the market. ADHD treatment is not antipsychotic primary treatment, but one drug, particularly Abilify or aripiprazole currently in the market, also used for off-label for treatment of ADHD. So we intend to develop our drug for all four major indications: schizophrenia, bipolar, major depressive disorder, and ADHD. But next slide. So next slide, please. So the treatment goal is often, see what happens in today's treatment. The major challenge the physicians face is often when the acutely ill patients are treated with very old olanzapine or a risperidone. But after a couple of weeks, what happens? These patients suffer from side effects, but the doctors would like to change medication. And then around 40% of the patients, they do not respond to changing the medication. That's the major problem. So our goal in this treatment, if they take medication in acute setup, there is no need to change. They can lifelong take medications. That's our approach in the treatment. Go to the next slide. So as I mentioned at the beginning, schizophrenia is caused by imbalance of dopamine, serotonin in the brain. Imbalance of that dopamine, serotonin can cause other neurochemicals. So other neurochemicals in the brain that lead to a lot of imbalance in other neurochemicals and other comorbid conditions. Go to the next slide. So these are other drugs developed in the last 20-25 years. Our drug is an improved version of what's been built upon earlier on. So go to the next slide. So this is the kind of in the pharmacology wise what makes it different. Our drug not only addresses the target engagement, most important differentiation is neuroinflammation, and then side effect is very clean profile. We go to the next slide, please. So the clinical development is done 3 different phases. This is the phase 1 study. Even though the study was conducted in the US, we put US patients as well as Asian patients to know the side effects in the global population, patient population. Go to the next slide. So this is the clinical data, what we have to do in the clinical phase 1. We need to dose the very high, as high as possible, till patients get a lot of side effect. So then we decide which dose is better in patient population. That's what the data here is. We dosed up to 100 milligram. The actual dose when it comes to market is 15 milligram. It's very well tolerated. Go to the next slide, please. So in the phase 1 study, in the stable patients, we have seen efficacy for schizophrenia, cognitive improvement. It's very hard to see in 10 days of treatment, cognitive impairment with existing drug. This is really good data. Next slide, please. This is the phase 2 study design. Go to the next slide. So this is the phase 3 data. So the PANSS is a scale, positive and negative symptom scale. Globally, it is used to evaluate severity of schizophrenia, and then also how good is this drug compared to other drugs currently in the market. In 1 month of treatment, we are seeing 20-point reduction in PANSS score. Without going into the detail, how good is this 20-point? I showed you 6 drugs comparative data. The 6 drugs data, if you compare this one in the similar trial, they showed anywhere 13 to 18 point. We have seen 10-point improvement, 18 point, 20 point improvement, each point can be translated into 10 percentages. If you go to the next slide, please. So this is very important. Most of the drugs currently in the market reduces positive symptoms, hard to treat negative symptoms. We are in 15 days, it has shown good efficacy. But this is really great data, we believe, when this drug comes to market, patients will be benefited with this. Go to the next slide, please. So this is the side effect profile. I talked about side effect, neuroleptic side effect. The drug, if you look at the gray bar, that is Abilify. That's one of the top selling drug. It's a $3.5 billion sales annually. It's considered one of the safer drug. Compared to the safer drug, our drug 15 milligram, it is almost 50% better than the one of the widely used currently in the market. And then I mentioned about endocrine side effect, prolactin. As you can see here, with our drug, it doesn't increase prolactin. There is no change in hypothyroid marker, no weight gain, no blood sugar change, no cholesterol increase or cholesterol is low. It's a very good profile. Go to the next slide. So this is a summary of that very clean profile. Drug is working very well. We haven't seen any suicidal ideation, suicidal increase in patient population. Overall, it is very well tolerated. Go to the next slide, please. This is the phase 3 design. Currently, we are doing a global study in 1,000 patient population. So 2 doses, 15 and then 50, treated for a month. And then they can roll over to another study that is 1 year treatment. After that, drug reaches the market. So it's progressing very well. I talked about drug-drug interactions. When a patient takes more than one drug, you expect to see side effects. This data is of that. If you look at other approved drugs versus our drug, lower is the better. If you look at our drug, it's the lowest one is our drug. Lower the position, better see. It's very well tolerated. Go to the next slide. So another one is how quickly drug acts in human. That's also matters in the treatment. If you look at our drug versus other aripiprazole is a top selling drug currently in the market, it takes around 12 to 14 days to achieve clinically meaningful efficacy, beginning to see. Our drug in the 5th day itself will show this is really a week or higher. It's very good profile. Go to the next slide. This is compared to other drugs in the market. So these are the drugs currently in the market widely used. We have seen very good profile. Go to the next slide. So this one I already discussed about it, the comparative data. Next slide, if you go. So just take 2 minutes to show connection between the pulmonary arterial hypertension and pulmonary fibrosis. Go to the next slide. So, those who are clinicians here, they may appreciate here. PAH and an IPF, they are lung diseases, different parts of the lung. So PAH in the small arteries and then IPF in the air sac, they are very big and very loud. So the bottom line here is the symptoms what you see, the neuroinflammation or arterial inflammation, lung inflammation in general, fibrosic fluid accumulated, and then breathing problem. At the early stage to mid stage, yes, these two are 2 different diseases. At late stage, you see significant overlapping symptoms in these patients. So, go to the next slide. So this is our data, translational data. If you look at the second column, we use PAH in animal model, and then treat with our drug, the red bar. And then if you look at the other 3 drugs, there are only 3 types of drugs currently in the market for treatment of PAH. PAH patients survive only around 5 to 7 years average survival post-diagnosis. Generally, we see after around 40 to 45 years age onset of disease, unless it's genetic. That's the kind of onset. They survive around 5 to 7 years. IPF patients survive only 2 to 3 years. So, if you look at compared to other drugs currently in the market, these are the only 3 types of drugs currently available. Our drug has shown really a good efficacy in this model. If you go to the next slide, IPF. This is IPF is those who are not familiar with IPF is very close to symptoms in coronavirus infected patients. If you look at other than body temperature, symptoms what we saw, breathing and lung symptoms, they are very close to IPF. So IPF globally there are only 2 drugs available in the market. One is nintedanib, other one is compare these two drugs, our drug is certainly better efficacy. Okay. If you go to the next slide, again the survival rate is very good, and blood oxygen level mental techniques, with our breathing become much easier, survival is very good. So this is about the stuff that FDA has already approved for treatment of our drug in this patient population. We will be starting clinical studies globally in the later part of this year. This drug should be in the market for treatment of PAH and IPF sometime in 2026. Next slide. That's about it, and thanks for your attention, and happy to answer any questions.